Hey, good morning, everyone, and welcome to UCSF Center for Global Nursing Impact Series. This series aims to provide a platform for our nurses and global partners to share their remarkable work, offer valuable insights, and inspire our global community. Following the presentation, there will be a short Q&A, so feel free to write your questions throughout the presentation in the Q&A box below. My name is Rebecca Silvers. I'm the director of the Center for Global Nursing, and it's my pleasure to introduce this month's speaker, Simone Ippoliti. Simone is a pediatric nurse practitioner here in Oakland, California at UCSF Benioff Children's Hospital in the Department of Psychiatry, specializing in integrated behavioral health and primary care and crisis intervention. She's a dedicated global health advocate committed to advancing health equity, mental health, and trauma-informed care across diverse communities. Beyond her leadership here in the US, where she's championed public health initiatives and equitable access to care, Simone is also the co-founder of La Charla, a youth-driven health and education program in rural Uganda. La Charla has empowered hundreds of young people by providing education on gender-based violence, public health, and pathways to higher education. I'm so excited to hear more throughout this presentation. Please join me in giving a warm welcome to Simone.
Thank you so much. Thank you so much for having me. I'm really excited to share a little bit about La Charla today, a program that started as a culturally responsive health education initiative in Nicaragua and has since evolved into a youth-driven model for empowerment and education equity. Today, I'm going to talk a little bit about why this work matters, the challenges we face, and how community-led solutions can drive sustainable impact, even in politically and socially restricted settings. I don't have any financial disclosures. I do want to share, though, that all photos that are going to be shared as part of this presentation are being shared with informed consent by our participants. We are committed to ethical storytelling and representation. What that means is that we are really prioritizing dignity and agency and empowerment of our youth through the storytelling process. And so we're really uplifting their roles as leaders, as resilient beings, and the success of all of our La Charla participants. The idea is to make sure that we are not exploiting their story, but really uplifting their voices. I acknowledge that many times in global health storytelling, there are power dynamics. And so we really strive to represent our La Charla's work as being collaborative, community-driven, rather than being a one-sided intervention that was born out of a US intervention. So why does this matter? Well, adolescent health and education are deeply connected. In Nicaragua, they have one of the highest adolescent birth rates in Latin America. So that's about 79 births for every 1,000 girls. In the US, it's more like 15. So it's a huge disparity. Teen pregnancy is also a leading cause of school dropout, locking young people, especially girls, into cycles of poverty and limited economic opportunity. The reality is that a lack of access to accurate health information, contraception, and education leads to limited agency over their future. So less access, less education, less empowerment. La Charla means the talk, and it really began in 2015 as exactly that. It was born of a collaboration between myself and a local Nicaraguan nurse in the community named Esperanza. And she was really someone that the young people had already really trusted. And so it was important to really identify her as the community leader who was really going to spearhead this intervention. And we had many, many conversations in the initial weeks about how do we provide weekly reproductive health talks to youth in this small rural community where most people ended up working in the sugarcane fields as farmers. And our goal was simple: provide evidence-based, culturally appropriate health education that the youth could actually relate to and end up using. So what made us different? Well, it wasn't a top-down or externally designed curriculum. It was co-created with the community, and more importantly, it was co-created with our youth. And I'll talk about that a little bit more in the next slides. Early on, we saw that young people wanted more than just reproductive health education. So in these weekly charlas that they held, they started to expand them to include themes of gender-based violence, both how to recognize and respond to abuse, public health education, like dengue and chikungunya, and eventually COVID-19, mental health and self-esteem. So it was really important for our youth that they were able to help each other build confidence and resilience. And this matters because when youth feel heard and they have ownership over their education, they're much more likely to engage more and make more informed choices about their futures. During our first program cycle, students made one thing really clear. We had started this as a 8-week intervention just to see if the pilot actually worked. And of course, we realized very early on that we needed much more time to be able to effectively assess that. So we asked our youth, what would you need to be able to continue these weekly charlas? What would help you kind of be the leader of this and really take it on as your own? And they actually all said that they want more educational opportunities. Specifically, our senior leaders, senior youth leaders at the time said that they all wanted to go to college. And this was really telling because no one from this community had ever attended university before La Charla. And it wasn't because tuition was too high, actually the tuition was free, but because of all the other kind of invisible barriers that make university so untenable. It was the books, the transportation costs, food, and most importantly, the lost wages that they would incur if they weren't actually working in the fields. And those lost wages were really important because a lot of our young people were helping support their family. So because of that, most youth actually ended up dropping out of high school or middle school well before their senior year to go work in the sugarcane farms. And it was because they really couldn't justify the financial sense of staying in high school when it didn't lead to anything for them. It wasn't the more financially viable choice. And so we're trying to balance this with also recognizing that the longer girls stay in school, for every year they stay in school, the less likely they are to get pregnant. So while we were really trying to tackle comprehensive reproductive health services and education in our middle and high school students, we also recognized that we had to make staying in school a more lucrative option, something that they were able to really look forward to that gave them more educational opportunities and more financial opportunities. And I apologize, I'm not the most technologically advanced individual. Okay. So the idea for La Charla was really born in these initial conversations with our youth, them saying, to continue this program, we really want an opportunity to go to college, and us figuring out what those numbers were. And we actually realized that it costs about $500 back in 2015 to cover the cost of transportation and books and lost wages. And it actually was $500 is a little bit higher than that original number because we wanted to make it more financially tenable for them to go to university than to drop out. And our students really created this model. They came up with the idea that if they remained as La Charla leaders, so the oldest students that facilitate the weekly health chats, that they would get matched with a US donor and be able to have their full university education paid for, all 5 years. So as I said, back in 2015, that was about $500. We've raised our scholarship since then. It is now $750 a year to send one of our La Charla students to university. And in doing that, we also, through the process, established ourselves as a 501c3 nonprofit. So since we started, we've had many conversations about, do we expand, do we grow, do we move into other communities? But we really wanted to make sure that we were keeping our attention hyper local, focused on the community that really created this program in the first place, and ensuring that we are able to support the youth who have had such a massive impact on the birth of this program. And in the 10 years since we started, we have celebrated 27 university graduates. We have matched over 60 students with university scholarships, and we have reduced the teen pregnancy rate within this community amongst our La Charla participants to 0. We have not had a single youth who has gone through our full program who has ended up being pregnant before their 18th birthday. And beyond the numbers, many of our alumni from our program actually come back to co-lead the Charlas. They are really, really committed to creating a cycle of mentorship and leadership. It is so amazing to see the power of representation when our alumni return as nurses and educators and pharmacists, amongst many other career paths. And they're able to come back and facilitate Charlas with the younger adolescents and talk about their experiences in university in their early career, and really be a model and vision for what the younger youth want to work towards. So again, why does this model work? I would say first and foremost, it is culturally rooted and locally led. It's not about getting community buy-in, but really be intentional about community driving this initiative. It is also a youth-driven curriculum. It is youth-driven and it's youth-implemented. So they are really determining what they want to learn, and then they go out and research these topics and bring it back to the group. We take a holistic approach. We recognize that addressing health and education and economic opportunity go together. You really can't develop meaningful, sustained change in any of these domains without being cognizant of and working towards the others. And long-term investment in our community leadership. So as I said, the alumni return to mentor the next generation, and many actually serve on our community board of advisors. So they're always engaging in conversations around, are we doing the work we sought out to do, and are there areas where we need to pivot and really be responsive to the needs of the community? This model can certainly be replicated in other communities that are facing similar barriers, because it really is contingent on the fact that local leadership is key. So challenges. Let's be honest, this work is not easy, and there are many. In Nicaragua, there has been a lot of political and economic instability, making it really tough to plan long term. We are regularly pivoting. As we grow, we need to maintain quality, and expansion is great, and moving into other communities and being able to take this on a much larger scale is always the goal. But not if it waters down what makes La Charla so special, which is really this hyper-local emphasis. Next, donor fatigue is real. We've been really incredibly lucky with support, but we're competing with so many other causes for funding, and those dollars get stretched pretty thin. And on a bigger scale, global aid is shrinking. As we've seen, there have been recent cuts to US aid and other programs, and it's making it much harder for grassroots initiatives to survive. The reality is challenging, but that just means we have to be smarter. And I think in a lot of ways, it's an opportunity to be much more creative about how we approach our global health work. Opportunities. We always are hoping to expand our scholarships to more students. More money, more opportunity for scholarships. Strengthening mental health supports in our charlas. This has been something that our youth have really raised as being a really important aspect of the La Charla program, and the thing that they really get most out of is being able to talk about power dynamics in relationships, being able to talk about depression, being able to talk about all these different drivers of substance use, which is really high in this community. And so in being able to really guide the discussion, they're able to keep the themes really timely to what they're seeing in their own community. We hope to actually formalize this amazing sort of ad hoc alumni mentorship network we've been having and make sure we're able to partner our students with alumni so that they really can see a clear path towards economic and educational opportunity in future. We, as I mentioned, definitely need to figure out how to diversify our funding sources. So we've tried to get really creative in that way. We are relying on small fundraisers that we hold on a frequent basis. We have been incredibly lucky, I think, and incredibly intentional about how we raise money so that we aren't perpetuating this donor fatigue. And most importantly, we are continuing to always keep our true north as continued investment in our community leadership. So really trying to ensure that what we are doing is not just an educational program, but we are bringing about generational change, that our youth from the La Charla program are able to help meaningfully impact their own community. Any questions?
Simone, thank you so much for that amazing presentation. I don't see any questions in our chat, but I guess one question that I have, you talked about the Charlas and this program. Could you explain a little bit more about the day-to-day of the program? Like, is it a weekly meetings? Like, what does it entail? How many people gather? Is it a time after school, before school, during, is this integrated in their schools? Like, how does the Charlas um, kind of integrate into their day to day?
So I would say all of the above. So we initially just had the Charlas be a weekly session that was embedded in the high school curriculum. This is back in 2015. And it was really helpful to have it part of the regular school day. It was great to get the school buy-in. But what we quickly realized is we were missing a huge swath of youth who had, who go to schools in other communities and have to bus to other schools, or who can't afford the local high school. And so we diversified our options. We have after school options, we have before school options, we have a Saturday program. We still hold the program that's embedded as part of the school day, but it's now held at the health post so that everyone can attend or has the opportunity to attend. So we, at any given time, are offering the Charlas to about 80 students. But each session is probably more like 12 to 15 students at a time. And I think like 4 or 5 are being held at any, my math might not be mathing on that one, but there's essentially like several Charlas that are held during the course of the week, all covering the same theme. So they go through each part of the curriculum at the same time.
Yeah, and tell me a little bit or tell us a little bit about the curriculum. So is it how is that designed and what does that actually entail?
Yeah, so there's some core topics that we follow every year. Making sure that we're covering contraception, we're covering STIs, gender-based violence. We cover mental health, self-esteem, leadership skills. And then there's sort of this ad hoc additional themes every year that the youth are really driving the conversation around. So when the pandemic hit, we hadn't been doing a whole lot of public health education. But what we were finding is that a lot of our students also served as community health workers, and they wanted to know how they can keep their community safe. And so they really petitioned for part of our curriculum having to do with hand washing and mask wearing and how do they talk to their community about COVID-19. Nicaragua was really ravaged by COVID-19, but this community was fairly protected because they got the supports in place right away. And our youth drove that. That was not something that I came up with. That was not something even Esperanza came up with. So we have about, I would say, like 12 core themes that happen every year, but a lot that is adjusted to meet the needs of that particular class.
Incredible. A few questions in the chat about how to get involved and where in Nicaragua this is. I think we're definitely happy when we'll post this session online on our IGHS YouTube channel and on our socials, and we'll be able to put a link to your website because I know you have one that we'd love to share. So where people can find out more information. But tell us where in Nicaragua this takes place.
Yeah, so part of why I actually didn't name the specific community is part of the like keeping our youth protected and private. But I would say it is a community that's about 30 minutes outside of Leon, which is a major city. Again, it's a sugarcane farming community, so that's pretty much their entire industry. And it's very, very rural. So I think the whole community itself is about 5,000 people.
Incredible. Let me see if there's any other questions. Simone, it's such a pleasure to hear about your work. We work at the same hospital here at UCSF, and we have not crossed paths because our departments are so different. But her work is incredible. Tell me about your co-director or co-founder.
Yes, so my co-founder is Esperanza. We have been working together for over 10 years because we had a year of really preparing for this program. And the way we got connected is I was actually in nursing school at the time, and I had originally been really interested in teen pregnancy and why sex ed is so bad and why it doesn't actually effectively seem to work. And these were questions that Esperanza was really asking around the same time. And she had long partnered with my mentor in nursing school. And so my mentor connected us, and it was just love at first sight. I mean, she's family to me now, and I could not imagine. I mean, I can say very clearly this program would not exist without her. She is absolutely the heart and soul of the entire thing. And it is part of why I think we've been so hesitant to expand to other communities, because so much of what makes this work is certainly the youth, but it's also Esperanza. I mean, I don't think I mentioned this earlier, but we have no US staff. So it is in the US, it's myself, and it is something I do out of my 9 to 5. And I have an amazing board of directors that's been so supportive in helping kind of build our little engine that could on the US side. But we really try to ensure that we are focusing all of our financial overhead outside of scholarships into our Nicaragua-based team. And so that is Esperanza. That's also one of our former students, Kelvin, who is now working as our program director. Without them, we could not do this.
Yeah, I think it's just incredible to hear the story of how this developed and how this program is focused so much on youth driven. We have so much to learn from our youth, and I think this program really exemplifies how they can really drive their health and wellness, and they know the things that they need to succeed, which is really exciting to hear. And I think when I think about the WHO building blocks, or I think about social determinants of health, like it all comes in my mind here when I think about like how you spoke of how the economic drive as well as the health drive, how those are so hand in hand. I think this is an incredible example um, of that in the community, and how you guys sought to address that is truly remarkable. And the goal of having no teen pregnancies and reaching that with the community is is pretty remarkable. So thank you so much for sharing today, and we're really lucky to have you. There's just a comment saying this is wonderful. Thank you for the presentation. And I wish everybody just a wonderful day, evening, wherever you are. Thank you so much for joining us, and we'll see you next month. Thank you so much, Simone. Have a wonderful
Thank
day.
you.